about an hour away from the Canadian border. Somehow or another, they managed to provide health care for every man, woman, and child in their country at about half the cost per person than we do.
Right.
Somehow, the cost of prescription drugs in Canada, a fraction of what it is in the United States. We have got to have the guts to take on the insurance companies and the drug companies and move forward toward a Medicare for All, a single-payer program. And I'll be introducing legislation shortly to do that.
Well, there you heard it, guys. Bernie Sanders is going to propose, he just announced there, as you guys saw, a single-payer Medicare for All system that will cover all Americans and will eventually be cheaper than what we have now. But a little bit of context, he was on Chris Hayes on MSNBC. He went to talk about the failed GOP plan, the AHCA, the American Healthcare Act. That was a disastrous plan. It was going to kick 24 million Americans off of their healthcare insurance. It was going to make the premiums rise in 2 years. I don't know how the premiums would go down in 8 years. The premiums never go down in history, so they are always going up, and it says it would be down by 2026, but of course, if we're going to take the other stats, we have to take those with it. But regardless, 14 million would lose their insurance in the first year. CEOs making $500,000 or more get a huge tax cut. And a 64-year-old making $24,000 who currently pays $1,700 in premiums under Obamacare would then be paying over $14,000 in premiums annually under the terrible, terrible GOP healthcare plan. So he was celebrating basically the death of that plan and the fact that it didn't work. And he's announcing a better plan. So let's hope it goes through. We need a single-payer Medicare for all system so we can finally catch up with the rest of the modernized industrial world.
Not only